What factors predict tonsillectomy success for sleep apnea? Imagine waking up feeling refreshed after a good night's sleep. For some people with sleep apnea, removing their tonsils might help. But not everyone benefits equally. Let's look at what predicts a successful outcome from tonsillectomy for sleep apnea. First, the severity of sleep apnea before surgery is a big factor. If a person has a mild case with fewer than 30 obstructive sleep apnea events per hour, the chances of success are very high. In fact, studies show that these patients can see their apnea decrease by 50% or more, and some are even cured. But if the preoperative apnea is more severe, with over 30 events per hour, success drops to about 72%, and only around a third are completely cured. So, the less severe the sleep apnea, the better the chances. Next, the size of the tonsils matters a lot. Patients with enlarged tonsils, especially grades 2 to 4, tend to do much better after the procedure. These enlarged tonsils block the airway during sleep, and removing them can open up the breathing passages significantly. If the tonsils are only slightly enlarged or normal size, the surgery might not make as much difference. Body weight also plays a key role. People who are not obese have higher success rates. For non-obese patients, the cure rate can be nearly 50%, with success reaching almost 90%. But for obese patients, success drops to about 34%, with a success rate of around 61%. Extra weight can cause airway narrowing in many ways beyond just enlarged tonsils, making surgery less effective. Age and other health conditions also influence results. Young children under 3 years old and those with other health issues like obesity or severe sleep apnea tend to have lower cure rates. Children with craniofacial abnormalities or syndromes like Down syndrome often have different outcomes because their airway issues are more complex. Choosing the right candidates is very important. Only about 5 to 10% of adults with sleep apnea are good candidates for tonsillectomy as the first treatment. It works best when enlarged tonsils are the main cause of airway blockage. Patients who have tried and not tolerated continuous positive airway pressure therapy and have large tonsils are more likely to benefit. But if sleep apnea is mainly caused by obesity or other structural problems, surgery might not be the best choice. When these factors are considered carefully, tonsillectomy can produce good results. Success rates in studies range from about 48% to nearly 95%, depending on how patients are selected and how success is measured. Many patients with mild to moderate sleep apnea and large tonsils see their apnea decrease from over 40 events per hour to just a few. Understanding these factors helps decide if tonsil removal is the right step. It's not a guaranteed fix for everyone, but for the right person, it can make a big difference in breathing and sleep quality.